February, we're recognizing American Heart Month, and Bounce TV's newest team member, Rockman Johnson, joins us right now. And Rockman, tell us about this series, Go Red.
Well, Brittany, first, it's good to be here with you. And you know, it is the #1 killer of women, and 1 in 4 deaths in America are caused because of this disease. It's a silent killer with very little warning, so finding out if you're at risk is very important. Now, I sat down with cardiac specialist Dr. William Dixon from Tallahassee Medical Center to find out exactly what is heart disease.
Heart disease ends up being a lot more than just blocked arteries, but by far that's the most common.
It's the cause of 1 in 4 deaths in the United States each year. With a price tag of over $100 billion annually, it's one of the most expensive healthcare challenges we face. The heart's job is to push blood filled with oxygen to the rest of the body. When that doesn't happen, that's what causes distress and creates a cardiac event. Now, treatment options are serious, but medical advances have made survival rates much better, especially in the case of congestive heart failure.
Congestive heart failure typically is due to weakening of the heart muscle. The most common cause of that is blocked arteries. So first we find out if they have blocked arteries. If they do, and we can improve the blockage with stents or bypass surgery, often the strength of the heart will improve.
So let's say you have a blocked artery. Doctors will bring you into a cath lab like this one, where they'll put you on the table and take a picture of the inside of your heart. They'll provide a stent like this one, and this small piece of metal just could save your life. Having a cardiac event is not totally preventable, but there are some changes that you can make in your life to lower the chances of risk.
But a lot of behaviors can increase the chances of having heart disease. Probably the worst offender is cigarette smoking. It just wreaks havoc on the arteries. Most patients, if you ask them, people that smoke, what do they die of? They tell you lung cancer. That's actually not true. Most people that smoke die of cardiovascular disease, either heart attack or stroke. So avoiding smoking, if you smoke, stop, will do more for you than any medicine ever invented.
Dr. Dixon also says that monitoring your blood pressure through regular doctor visits and daily moderate physical exercise keeps the body functioning normally. And that prevents you from having to see someone like him in your future. So now you know the common forms of heart disease and that it's no longer a death sentence. Tomorrow, we'll talk to a young girl who was born with multiple heart defects, and her parents were told that she wouldn't survive more than a year. Brittany, back to you.
So you talked a little bit about the lifestyle factors. Yes. Maybe explain more so, you know, what are some of the groups who are mainly at risk?
There are a whole lot of groups at risk, specifically African Americans. Those groups are people that don't traditionally go to the doctor, don't listen to the signs, and because of economic issues, can't afford to go to the doctor. So as I talked to Dr. Dixon, he has some really great details to share as to how people can really take advantage of their health. But first and foremost, it's listening to your body. When you get out there, if something's wrong, if you feel a twang in your heart, go find out something. Go to the fire station, get your blood pressure checked. The second thing, and most importantly, go to the doctor. It's important that you go and see what's happening with your body. And last but not least, time is muscle. If you had some kind of incident, CPR is important. If you don't know CPR, learn CPR, because the sooner that you get that blood flowing back through the body, the better chance you have of preserving that heart muscle. Because once it's dead, it's not like another muscle that can grow back.
All right, some very important advice there. Thank you for joining us.
Thank you.